Hello, my name is Edwin John Rodriguez, your licensed health insurance representative. On today's video is a little different than previous videos. We had a recording of some webinars for our clients. These clients are being affected by changes going on in the new year, and I took it upon myself to make sure that my clients are getting this information in a group setting and also recording the content to share with my community here on YouTube. If you're in Central Florida or with one of the plans discussed in these webinars, make sure that you reach out so we can discuss if there's any pertinent changes related to your insurance. I hope you enjoyed this information. Thank you so much for watching. And remember, the best prescription is a subscription.
The reason for this call today is just to make sure that everybody knows about what's going on for 2026 related to their plan. I've received a decent amount of inquiries already as far as what's going on with this plan for the new year. And I've actually spoke to a client yesterday and reviewed this information similar to what we're talking about in this format. So I got a little more familiar with the change. In short, the plan that you guys have right now, everybody who's on this call today is currently on this plan right here. If you're receiving this message in an email, this video later, for those who will be reviewing it later, this is the plan that you have right now is with Aetna. It's the signature PPOs, the 439. If you guys recall, last year or the year before, most folks were on this plan before. Aetna came out with a newer version of that plan, which was this one. And then they said, hey, everybody migrate to this one. Now that one is just going up in the specialist copayment. So now they're saying, hey, everybody migrate back to the other one. What we're talking about today is completely optional. There's no obligation to make a change. If you're happy where you're at, you don't have to do anything. Your plan will just roll over for the new year. Okay. That's assuming you want to stay with Aetna. If you want to stay with Aetna and you want to maybe search, if you want to stay with Aetna, but you want to bring down some of your costs, or one of them really, this plan here is going to be the one putting you back on this plan here would be the idea in this situation. Again, it's completely optional. Now, maybe there's a situation where Edwin is great, but what are my other options? Essentially, any other PPO plan that is out there right now in 2026 is not going to look much better than what we're going to be talking about on this plan right here. They're all PPOs, or insurance companies are leaning heavier into the HMO category. So what they're doing is they're beating up on these PPOs a little bit to entice people, I think, to go over to an HMO category plan. Although that's not required, that might be something you want to consider. A client I was speaking to earlier this week, we discussed with her this information, and we're considering a possibility of an HMO. So possibly going to another carrier is something we can consider as well. We'll talk more on a one-on-one basis if that's the case for you. Of course, we'll want to make sure that the doctors match up well, and of course the medications too. But for today, we're just going to talk about the current Aetna PPO that you have right now, which is again the 439 plan, versus the 271 plan, which is essentially a comparable option. Okay. Now, to talk about the similarities between these plans, both plans are PPOs. So nationwide coverage, no referrals required, out of network available for you. If your doctor is currently taking this Aetna PPO, they're currently taking this Aetna PPO as well. The networks are the exact same. So you don't have to worry about searching, is my doctor on this plan if I move from one PPO to another here with Aetna. The difference of these plans is going to be what's highlighted here in this document. We'll scroll down together. Anything that's highlighted in orange, for example, is going to be the differences between these plans. Okay, we'll cover that in just a moment. And then let's see. Oh, this update's not automatic. If you are interested in making this change from the 439 to the 271 plan, or any change for that matter, just let me know. Anytime after October 15th to December 7th is the time where we can actually make a change to this. And then we also have from January 1st to March 31st to make one final change for the year. Okay, so I'll repeat that again. October 15th to December 7th, as well as January 1st to March 31st is the time of the year we can make an edit to this. I'll remind you again in the recap email I'll send out. To go into the details here again, both of these plans are zero premium plans. There's no cost for you. For the person who just joined, just to highlight real quick, this is the 439 plan. This is the plan you have right now. And then this is the 271 plan. This is the newer version of it. Again, this update is optional. You don't have to do it if you're happy where you're at. My job is to make sure you're staying in the loop as far as any potential updates for the new year, okay? We have until March 31st to finalize any changes should you wish, whether that's to go from one Aetna plan to another, or to go from Aetna to another company like United Healthcare, Humana. Those two companies are also viable PPO options, but in most cases, if you guys are with Aetna right now, it's for a certain reason. Most likely it's because of a certain doctor, maybe wasn't with United or Humana. Maybe you like the dental benefit that with Aetna versus Humana and United. Those are the reasons why people would go the Aetna route, is generally because a certain provider that takes that plan versus the other two companies that I mentioned. And then of course the dental is very strong with Aetna as well. So going into the benefits again, both plans are zero premium plans. You pay nothing for them monthly. All you do is pay for your Part B premium. For those who don't know yet, your Part B premium for next year, 2026, is going to be going up to $206.50 per month. Please don't shoot the messenger. I'm not making the rules. I'm just here to share the memo. This is probably the largest increase I've seen on a Medicare Part B premium since I've been in this business almost 20 years now. Just as a heads up, something to just keep in mind. Now that's the standard cost of your Part B premium. For anybody who's considered a high income earner, that Part B premium may be inflated. Either way, it's still going up by that amount. From this year, 185, 206, about $20 a month is the Medicare premium going up. Okay. All right. As far as the benefits to the plan, okay, both of these plans are going to include a zero deductible. What that means is you don't have to come out of pocket hundreds or thousands of dollars first before the plan kicks in for services related to hospital and medical care. Both of these plans have a zero deductible, meaning if you go to the hospital, you have a surgery, you have a doctor's visit, an outpatient procedure, whatever it may be, you're just going to pay your applicable copayment right out of the gate. You just pay your flat copayment based on the services you're seeking. Okay. Next is your maximum out of pocket. The max out of pocket, as a reminder, that's your safety net. So God forbid you have a catastrophic year, you're seeing a lot of doctors, having a lot of surgeries, you're in and out of the hospital a lot. God forbid, knock on wood, you're dealing with some type of therapy like chemotherapy, physical therapy, whatever. The most you're ever going to spend in the calendar year is $5,900. Think of this number as your safety net, not a goal. I hope you never need your insurance, but God forbid you have a bad year. $5,900 is your safety net. That's the cap as far as the most you're going to spend in the year for out-of-pocket costs. Okay. Now, that's assuming you're in network. If you go out of network, your maximum out-of-pocket does increase. You can assume it's about double that, which is a good estimate. Okay. Now, with the PPO plans, you have the flexibility to go out of network. Yes, you do. But I do not recommend going out of network unless you really needed to, okay? Because you shoot yourself in the foot if you do that, because your max out of pocket increases for the year if you do that. I'm going to explain that again real quick because this is very important. If you go to one doctor out of network, just one little measly doctor's visit out of network, your safety net now is no longer this. It's double that for the rest of the year. Even if the rest of your doctors for the rest of the year are in network, this is your max out of pocket already doubled for the year because you went and saw one guy out of network. So again, just because you can doesn't mean you should. Okay. Now with Aetna or with most PPOs, you have plenty of doctors in the network to choose from. Okay. So you can actually go see plenty of doctors. There's generally going to be plenty of doctors to choose from within the plan network. You can go to aetnamedicare.com. There's a provider search tool there. If anybody needs a reminder on that, I can send you the link for that. When I first set you up on your Aetna plan, that should have included a link on how to search doctors in there. But if you forget or you lost that email, whatever, aetnamedicare.com, there's a spot in there to find providers. You can search as a guest, and then you can select your plan. Any of the PPOs are going to be the same, and then you can search doctors that take your plan with Aetna, okay, who are in network. This is the best way to do it if you're looking to verify providers. If you need help with that, of course, please let me know. This is what I'm here for. So doctors' visits on these plans are going to be zero copayment on both plans. As a reminder, guys, the plan that you have right now is the one that's on the right column here, okay, the 439 plan. And what we're doing is we're proposing this plan here, the 271. Okay, so primary care doctor visits are zero after in-network. If you go out of network, it's a $55 copayment. Again, it allows you to go out of network, but you pay more. On top of that, this max out-of-pocket doubles just to beat a dead horse there, okay? Specialist visits, and this is the part that's really rocking everyone's boat here. It's, hey, Edwin, I got my annual notice of change, and it told me my specialists are going from $40 to $75. Is that right? Yes, it is. With your plan next year, specialist is going up to $75 if you stay on your current plan. Again, the purpose of this call today is to tell you that, hey, if you like Aetna and you want to stay with Aetna, then I recommend going to this plan, possibly. Maybe it makes sense for you, maybe it doesn't. We'll go over more details as we go through this. Additionally, we'll talk one-on-one, right? So if you decide you want to stay put, you can just send over a message. Edwin, looks good, thanks for the update, but I'm just going to stay right where I'm at. It doesn't make enough sense for me to make a change. That's going to be some of you. Other folks say, hey, Edwin, I want to make this change. No problem. Schedule a call anytime after October 15th, and I'll help you with that update, okay? I do ask, pretty please, You allow me to help you with the update. If you make a change without me, I lose you as a client. Then I have to cry myself to sleep. And then my wife is going to have 4 babies on her shoulder, crying on her sweater there. We don't want that, especially a grown man crying on a woman's shoulder. All right. So the biggest difference here from your current plan is that specialists are going to be $75 versus $30 on the newer version of your plan. Okay. Anything highlighted in orange is what's different. If it's in white, it's the same with both plans. So we're not going to tackle it too much. Like skilled nursing care, the first 20 days are covered for $218 per day, or excuse me, the first 20 days are 0 per day. Anything after day 20 is $218 per day. Okay. Home health care is 0 copayment for that. Outpatient mental health care, a little bit different on some of these costs. It's a $5 difference, nothing worth writing home about. This is outpatient mental care. This is like psychiatrist visits. Okay. Emergency room is the same, $130. As a reminder, you have worldwide coverage for emergency care. Anywhere on the globe, you have coverage for emergency, okay? For urgent care, you're covered anywhere in the United States. As a reminder, there's no network at that point. Go to wherever you need to. Okay. Now, this is another difference that kind of makes your current plan look a little bit more attractive. This is, again, your current plan here on this one. Your copayment in the event of hospitalization is a copayment of $290 per day for days 1 through 4, and then 0 for anything after that. Okay, so if you're in the hospital 1 day, it's $290, 2 days, $580, 3 days, so on and so forth. After day 4, it's a 0 copayment for anything after that. So all you're doing on this plan is you're paying this much for the first 4 days per day. If you're on the new plan, that copayment goes up by $10. So it's $300 per day, and it also goes up by an extra day. So it's 5 days is what they're charging you for hospital stay on the new plan by $10 more. So to look at the difference here, that's pretty easy math. 300 times 5 is 1,500. Over here, it would be 290 times 4 is 1,160. So in the event of a hospital stay of 5 or more days, one plan is going to be $1,500. The other one is $1,160. Okay, so that is a bit of a difference there. But the question you want to ask yourself is, am I going to a specialist more often, which is a $45 higher copayment on your current plan, or do I really want to have that hospitalization cost a little bit lower? That's really going to be your biggest difference here between these two plans. Okay. Now, as a reminder, doesn't matter what plan you have. Okay. The maximum out of pocket, just to remind you here, is the same on both. So my point is, whether you travel a mile an inch at a time or a foot at a time, a mile is a mile. I hope you guys understand that analogy. This being your mile, your max out of pocket is the same on both of these plans, but the difference is going to be how you get there. Higher specialist copayments or a little bit higher of a hospital copayment. Make sense? Hopefully. Okay, so that's really the biggest differences between these two plans. The rest of the information is going to be relatively similar. New for next year is an increased deductible. They have a deductible for your plan, whether you're on your current plan or whether you're on the new plan. You have a $615 deductible for any medications that are tiers 4 or higher. Most of my clients' medications are going to fall under the first 3 categories, tiers 1 through 3. If you have any medications that are tiers 4 or higher, so it's going to be these guys here, tiers 4 or 5, you're going to be responsible for a $615 deductible before they're going to help you with those medications. Now, to expand on the prescription portion a little further here, actually before I do, please note that the cost of your medications are going to be the same on both plans. The way these medications are covered are going to be the same on both plans. There's a document that is called a formulary, which tells you how these prescriptions are covered. And again, they're both the same plan as far as how the prescriptions are covered on this plan. Okay. And your out-of-pockets are the same on both plans as well, as a reminder. Okay. So no difference on the prescription side of this conversation. The thing I want you to really hang on to is that there is a deductible for any higher cost medications. If you have a lot of higher cost medications, maybe another plan, another company might be something to consider. Just food for thought, no obligation, just something to think about. Now, with that said, something new for 2025 and still for 2026 is what we call a catastrophic limit. Something new, part of some legislation that the government passed a couple years ago, is individuals are now capped as far as how much you spend in the year towards prescription medications. And that's called a catastrophic limit. So for 2026, you, the consumer, are guaranteed to never spend more than $2,100 in the calendar year at the pharmacy. It used to be the opposite. You guys may remember the term the donut hole, the coverage gap. You might have had family or neighbors, friends who fell into that. That used to be a limit as far as what the insurance companies would spend in the year. But now the limit is as far as what you spend in the year. They're protecting the consumer more than the insurance companies now. So just to recap that again, what was in the past doesn't matter anymore. But to recap this again, you're capped as far as how much you're going to spend in the year towards prescription medications. Just like your maximum out of pocket for medicals, you're never going to spend more than this in the year. With the prescription portion, you're never going to spend more than $2,100 in the year for out of pocket costs related to prescriptions. That's going to include your deductible. That's going to include any of your copays for your medications or any of your percentages that you pay for your medications. So if you have a lot of costly medications, whether you're with Humana, United, Aetna, Cigna, Florida Blue, Freedom, you name it, any company, you have a $2,100 cap. You're never going to spend more than that in the calendar year. Okay? So keep that in mind. If you do have a lot of costly medications, please let me know so I can expand on this further. I don't want this information to be too info dense since I am sharing this publicly with my crowd here. But just to touch on it lightly, anybody who has drug coverage through Medicare, that includes everybody in this call, everybody receiving this message, there's a program called M3P. M as in Mary, the number 3, and then P as in Papa. What that stands for is the Medicare Prescription Payment Plan is what that stands for. And what that means is, let's say you have a couple high-cost medications, like Eliquis is a very popular high-cost medication, Xarelto, whatever. The cost of the Eliquis is around $600 per month. You have to pay that deductible first in January, okay, which will cover the cost of that medication. And then in following months, you'll pay for 24% of the cost of that medication. Let's keep the math simple. Let's call it 25%. 1/4 of $600 is $150. So you're responsible for $150 per month for your Eliquis. Okay. Now, if you have any other medications, I feel like I'm going too much into this here, but just hear me out. I promise it'll make sense in a second. If you have more costly medications, once your out of pocket reaches that $2,100 for the year, you're done. For some of you, that might be as much as quick as March. For some of you, that might not happen till November. For some of you, but that might not happen at all. Okay? But if you see yourself spending a lot of money on your medications early in the year, or even this year, I recommend reaching out to your insurance company, whether it's Aetna or another company if we decide to go elsewhere, and register for the M3P program. What they'll do is they'll say, okay, you're going to hit your 2,100 cap, right? So what we're going to do, Edwin, is instead of charging you all of those costs in the beginning of the year, we're going to spread it out equally over 12 months. So what's going to happen is they're going to end up giving you $2,100, and they're going to break that up into 12 monthly payments of $175. So you don't have to worry about coming out of pocket $615 in January, another $300 in February, another $300 in March, so on and so forth. And so you hit that $2,100. What they'll do is they'll just break that cost up over the course of 12 months into equal monthly payments. Some of you are already taking advantage of this. Some of you maybe are not. I sent an email out at the end of last year giving a heads up about it, but it is important if you have prescription costs that are higher, if you're looking to stagger those costs throughout the year. You don't have to, but if you do have costly medications, you may want to just stagger that out throughout the year. It's up to you. It's just an option for you. Okay. So enough on the prescription portion. Just to recap again on this, both plans have a deductible. Both plans are going to cover you the same way for the prescriptions. The tier levels are going to be the same. If you have very costly medications, you may want to consider the M3P program. It's totally free, but it's not automatic. Just reach out to your insurance company, whoever you're with in January, and let them know you want to register for that program, and they'll break down your medication cost for 12 months instead of front loading all of those costs in the beginning of the year. So I hope that makes sense. Marty, can I get a thumbs up if so? Thumbs up. Sherry, thank you so much. Awesome. Appreciate that. So I hope that makes sense, guys. I know it's a bunch of word soup, but I just try to explain that as well as I can. Now, this is the document that I have in my quoting tool to give you this comparison. And we're almost done, guys. Just a couple minutes left here. I want to show you how this also looks on Aetna's website. okay? Because both systems are going to show me the same thing, but they're going to have some differences from one document to the other as far as these differences. So I just want to show you real quick some of these differences here. Now, a reminder, the plan you have right now is the one on the right. It's called the 439 plan. That's the model number of it. Think of it as like a Corolla versus a Camry, right? Or it's probably the best analogy I can use, right? They're both Toyota, just two different models of it, right? The 439 is what you guys have right now. Everybody on this call is on this right plan, or the plan on the right here, okay? So I'm going to highlight what's different. Anything you see here in purple is what's going to be different between these two plans. With your current plan, you're no longer going to have an over-the-counter benefit next year for 2026 with your current plan. So if you enjoy that over-the-counter benefit, the newer version of it will continue to have the over-the-counter benefit for you. Okay? So again, I'm just going to highlight some of the differences that weren't on the previous documents. Okay? So the prescription deductible, I misspoke. I said tiers 4 and higher. The deductible actually applies to any medications tiers 3 and higher. Please pardon the goof on that. I literally this information just got released yesterday, so still learning it as I'm sharing it. So again, any medications that are tiers 3 or higher, that deductible is going to apply to. Just keep that in mind. Remember the max out of pocket I mentioned to you earlier, $10,000 if you go out of network, even if it's just one doctor. Please be careful with that. And then, as I stated earlier, that $2,100 is your out-of-pocket safety net, air quotes, for prescriptions in the calendar year. $2,100 is guaranteed never to spend more than that in the year towards prescriptions at the pharmacy. As a reminder, again, specialists are $75 on your current plan versus $30 on the proposed option for the new year. And the difference on the dental as well is something that people like. People really like Aetna because of their dental plan. It's very easy to work with, okay? Their dental benefit on the current plan you have now, it's $1,750 is what you get for your dental benefit. Some people say, well, that's going to be the reason why I'm going to stay with my plan, Edwin. I'm going to be using more dental than I'm going to ever be using for specialists. If that's the case, no problem. Stay on your plan for next year. Just send me a quick note and I'll update my records. You're going to stay put for next year, okay? But that's if this is pretty much going to be the reason why somebody's going to want to stay with this plan is because they like that increased dental benefit. With the new version of the plan, it's $1,500 for the year for the dental versus $1,750 on your current plan. Okay. Now the question you want to ask yourself is it worth having a $75 copayment instead of a $30 copayment for specialists just to have more dental? That's a question you answer, not me. I'm just here to shine the flashlight on the differences here. And let's see, what else do we have here? Both plans are going to cover your eyewear. Your current plan is going to give you $100 allowance towards eyewear. The new plan will give you $150 per year towards your eyewear. Okay, so a benefit on the new plan here. For hearing aids, they're going to cover you the same way here. The hearing aids, you have a credit of up to $1,700 for the hearing aids every year. That's going to be the same on both. What's going to be different is going to be the visit to see the audiologist. It's $75. An audiologist is considered a specialist versus $30 on the new plan. But the hearing aids are going to be covered the same way on both plans. I mentioned to you already the hospital. It's a little bit less on your current plan. It's $290 per day, days 1 through 4 versus $300 per day, days 1 through 5. Surgery at a surgery center is going to be a little bit less. With the newer version of your Aetna plan, it's $160 on the newer version versus $240 on your current plan. Emergency room is the same at $130. I covered that already. Basic x-rays are covered at a zero copayment at a freestanding facility. That's going to be like Diamond Med, Paramount Radiology, South Lake Imaging. Those are common examples of standalone imaging centers. If you go to the hospital, you guys may remember me telling you in the past, the bigger the building, the bigger the copay. If you remember that, hospitals, you pay $30 in an outpatient setting. Remember, it's only if you're outpatient. If you're inpatient, you pay your copay per day. But if it's inpatient, it's a $30 copayment. Sorry, if it's outpatient, that means you go to the hospital, have an x-ray, and you go home just for an x-ray. It's $30 on your current plan or $50 on the newer one. So as you guys can see, it's a little bit of a give and take, right? Some sprinkle a little bit better here, some sprinkle a little bit better over there. But I just want to highlight what people are bringing to my attention. Edwin, my specialist copay went up. You're right, it did. But there's some other things that maybe went down compared to your alternative option with Aetna, okay? Again, just food for thought. CAT scans are going to be less. Now, this is more advanced imaging. So here you're going to have a $200 copayment for a CAT scan Oh, wow, it's actually zero for, let me see here. Wow, most plans are going to have a higher copayment for this. So this is actually really good. If it's zero copayment for diagnostic radiology, this is going to be like CAT scans, MRIs, PET scans. This can be the biggest difference here. It's going to be zero copayment at a freestanding facility, or $200 on the new plan if it's at an outpatient anywhere else, or $350 on your current plan. Okay. I'm going to send you a copy of this document when we're done, guys, so you'll have this to reference at your leisure, okay? As a reminder, we have until October 15th before we're actually able to even make any changes, so plenty of time to muster on this information. Nursing facility, ambulance, those are going to be very similar. Fitness membership is included on both plans, so people who enjoy using the fitness membership benefit on these plans, it's included on both for next year. And finally, you have the OTC benefit is not included in your current plan. With your new option that's available, it's a $45 quarterly allowance for over-the-counter items. You can use it in the CVS store for over-the-counter, or you can do it through their mail order catalog as well, where it gets shipped directly to your house if you prefer that as well. Okay, so $45 per quarter for over-the-counter on the new one versus none on the existing plan. Prescriptions we mentioned already. Don't want to go through that again. And that is it for the details, guys. So with that said, that concludes the information here. I'm going to go ahead and end the recording. If you have any additional questions on this, of course, please let me know. For the people listening to this on a recording later, if you have any questions or you want to discuss this further, or if you want to update this, remember we have starting October 15th, you can hop back in the calendar. We can begin to discuss this after October 15th, or make a change after October 15th. As far as the details, I think it's pretty black and white as far as what I'm sharing here. As a reminder, the doctors' networks are the same on both, so we don't have to verify doctors. The medication coverage is going to be the same on both plans as well. So if your current plan is covering your medications, the new one will as well for next year. So I hope this information is helpful. Of course, if you have any questions, let me know. I'll be sending this again via email when we're all done. Wish you all the best and talk to you soon.